My name is Booker Terry King. I am the director of the J.C. Burn Center and the division chief for burn surgery. Pretty much wanted to be a doctor my whole life. I was pretty good in math and science and wanted to help people. And the only way to really bring all three of those together was a physician I saw. In the military for 20 years, which is a full career for the most part. I retired as a colonel. So I started as a captain and I worked my way up to colonel over the years. I became a burn surgeon really when I was deployed in Iraq in 2003. We were part of the initial push for Iraq, so I was part of the 212 MASH. And you know, we took care of obviously a lot of trauma patients, but there was a lot of burn patients that we took care of. And I found that it was really a knowledge deficit in terms of caring for burn patients, because none of us really had experience with that. And I said that is the area I think I can make the most impact in taking care of burn patients, because it's not something that, especially in a combat environment, that a lot of the physicians and providers really know how to do. So subsequent deployments, I was the burn expert. Burn surgeon is a surgeon that knows and learns the intricacies of taking care of a burn patient. A burn patient is unique in that it could be some of the sickest patients that you ever meet or that you ever take care of. I mean, the skin is one of the most important parts of the body. We don't even think of it as an organ, but it is. And when that skin is lost, that puts us at risk for infection and all kinds of things. And to take a severely burned patient, you know, when they initially come in to the point where they can leave, takes a lot of resources, is very multidisciplinary in terms of the amount of care that's given, and just the family, you know, being able to go through that for weeks and months on end. So it's probably one of the most complicated areas in medicine, I would say, in my opinion. I want patients to know that I'm deeply concerned about their care and their welfare, and that, you know, I sympathize and empathize with patients. I had an aunt who was treated here. She was a severe burn back in the early 2000s, and she's still alive because of the work that staff and the surgeons did for her back then. So if it wasn't for that, I mean, she could have easily died, and if it wasn't for that hard work and dedication that was put in, she wouldn't have survived. So that her story really gives me energy and gives me focus every day to go out and help the patients that I take care of and support them during this difficult time when, you know, they're here being treated. For me personally, it's really all about the patients. You know, surgery and all the other things but it's really, the focus is getting that patient well. And then I think burn is unique in that it requires a team. And most things in medicine do require a team, but burn is an obligation. You have to have a team. It's not only something that's nice, but it's something that's necessary. And when that team comes together to make that patient better, it's no better feeling than see that patient, you know, leave the hospital after being here for several months, and knowing that the team is because of the team effort that happens. Philosophy of care is that care needs to be centered on the patient and the patient's needs. Often, you know, we try to design our care that it fits a certain diagnosis or treatment, and we often forget the other needs of the patient in terms of socials and psychological and so forth. And I think my philosophy is we need to look at that holistically and then really focus on what the patient needs are. And oftentimes the patient will tell us. And when they can't tell us, you know, the family can tell us what these needs are. And really getting to know the patients, you know, I think is important, because that will allow us to care for them much better.